I'm Bernard Eichold II, MD, DRPH, and I was the previous health officer of Mobile County for over 30 years. Well, public health is a very interesting subject, and what really changed me from being a private practice internal medicine doctor to being a public health officer was the idea of being able to treat a community, not just one person at a time. So I had advanced degrees in public health. As a graduate of Tulane, they encourage people to do advanced degrees in multiple subject areas. So I have a master's in public health, which I earned in 1978, an MD in 1979, a doctor of public health in 1980, and then did internal medicine at the University of South Alabama, did a fellowship in Boston at the Joslin Clinic in Diabetes, then was the first reserve medical officer to become a flight surgeon in the Naval Air Reserve. I came to Mobile, went to private practice with Chuck Walsh and Henry Gwynn, merged that practice in with John McGee and Steve Davis, and then had an opportunity to be the health officer of Mobile County. And it was really very rewarding. And during the time of COVID, public health was an extremely important component of the healthcare delivery system in Mobile County, Alabama, and the United States. I was very concerned about it, especially since we had no immunity to it. This was a novel disease. We had no vaccines for it. We had no antivirals for it, and we did not have adequate personal protective equipment. So the whole population was at risk, and yes, I knew it was a very serious problem. That's why we took serious measures during the process. What we needed to do was flatten the curve, which means that everybody not get sick at the same time. So we had only a certain number of hospital beds in Mobile County, and by masking, getting people to change their social behavior, social distancing, hand washing, hand sanitation, anything we could do to prevent everybody from getting sick at the same time was the greatest challenge. The other component of that was that the politicians seemed to know more about healthcare than the doctors and the colleges of medicine, the schools of public health, the National Institute of Health, the Center for Disease Control, and they were just simply responding to what their constituents wanted them to respond to. But I was in private practice. I never sent a patient to Washington, D.C., to the United States Congress or Senate to get a second opinion about what was appropriate medical therapy for that individual. And that was just a challenge, but I knew that the politicians were simply doing what they needed to do, and they were going to say or do anything they could to be pertinent and relevant during a medical emergency. Well, there's a challenge right now in all phases of our society where there's distrust in many arenas. I think that public health is basically founded on science. They're basically well-respected academic institutions of higher learning that teach public health. And like with your faith and your church, you need to get the best information you can and then respond non-emotionally, but we need to respond with science, knowledge, and common sense in regards to public health. Well, HIV was already a known diagnostic entity when I went into public health in 1990. So there were lots of programs that were already being established in order to take care of persons who were infected with HIV. We were very fortunate at the Mobile County Health Department to write a grant, which was a Ryan White grant that allowed for funding to treat persons with HIV. And then we had a comprehensive program to try to educate people in the community. There was a lot of misunderstanding about HIV, who was at risk, and how it was really spread. So there was an opportunity to educate the community and then work with providing treatment for those who were infected. Well, I think public health and vaccines have extended the life expectancy of persons in the United States from around 35 to 40 years of age to over 70 years of age. It has not been MRIs, it's not been new medications, it's been good public health has extended the quantity and quality of life for everyone in America and across the world. When I was young, polio was negatively impacting a lot of people. We came up with a vaccine. We had a dynamic vaccination program, and polio has been significantly decreased worldwide. Smallpox, another infectious disease that killed millions of people, and with good public health, good vaccine programs, and working with people and educating people, smallpox has been eliminated as one of the major killers of human beings in the world. So public health is an extremely important component to quality of life, and life in America would not be the same without public health. With public health, we make sure the food supply is safe. Public health makes sure the water supplies are safe. Public health makes sure that sewage and garbage are adequately disposed of. So it's really just a very important component to everyday life in America.